Okay, it's 10:02. Let's start. Good morning, everybody. Thank you so much for joining us this morning. This morning, we're going to talk about sports injuries, which we've never really talked about before, and I'm very, very excited to know everything about it. Hi, Dr. Allen. How are you?
Hi, good morning, everyone. Thanks for tuning in.
So, Dr. Allen, you are one of the consultants at the International Orthopaedic Clinic.
Yes.
We're going to talk about injuries today, and I'm so looking forward to it. So can we start to learn what we're going to, first of all, can you talk a little bit about yourself and what you do? Because you are quite the sportsman. So let's hear a little bit about you and also what we're going to learn today. So over to you.
Okay, good morning, everyone. And firstly, thanks very much for tuning in. And thank you very much to Susan, Expat Living, for hosting us, and Vicky from Oslo Health for helping you organize. So first thing I'm just going to do is I'm going to share the screen and we can sort of ease into the talk. So, okay, so I work at the International Orthopaedic Clinic and I'm a consultant orthopedic surgeon. I'm actually British born and trained, that's why I sound like this. And today I'm going to talk about some common sports injuries and maybe how we can try and prevent them. So, who am I? I grew up in the UK. I'm an orthopedic surgeon. That means I deal with worn out joints. So I replace worn out joints using a robot. And I also see a lot of athletes and deal with sports injuries. And I'm the team doctor for the Singapore Cycling Federation and also the Wrestling Federation for Singapore. I used to cover the One Championship mixed martial arts events. And also I teach on rugby courses and cover international rugby events as well. So I've seen quite a few injuries in elite sports people. But actually, most of my patients are not elite sportsmen or women, and they are people, just like me and you, who like to exercise, but unfortunately pick up some knocks along the way. So the last 18 months has been pretty tragic, and it's been quite difficult to exercise in our normal routine. We've had a lot of closure of gyms. We don't play team sports anymore in the same way. And we're sort of stuck at home a lot of the time and don't get to go to the office. So many of us are taking up new sports or have reduced our sporting levels, which has really changed the spectrum of injuries that I've seen. So I thought I would share with you today some of those things. We talk about the commonest injuries I've seen in the last 18 months, really since the whole COVID situation began. And really how we can try and reduce those injuries and approach sports or new sports in a sensible way. So the first thing to do is, should we exercise and should we, go out there and put our bodies on the line? And the answer is yes, definitely. From many different perspectives, exercise is really important and beneficial for us. But like with many things, if you do too much of it or if you do it in the wrong way, it can cause problems. So before the COVID situation, I used to see a lot of injuries from contact sports, team sports, like martial arts, rugby, football. But nowadays, most of my injuries that I see are from things like running or cycling, HIIT activities, things like people who do CrossFit or F45 or any sort of high intense aerobic exercise. A lot of tennis players also, and also people who spend all their time in front of a Zoom call. Anyway, so let's start with running, because this is probably the commonest cause of injury that I see. And it's cheap, it's easy to do. You just put your trainers on, you go outside and go for a run. Most of the injuries I see are not from people falling over and breaking something, but actually from repetitive injuries or running too far, too fast, for too long. And so the actual definition of overuse really varies between studies, but it's really an injury that puts you out of action for over a week. And the injury rate in runners is actually pretty high. From some studies, up to at least a third of runners have some sort of injury or niggle for at least a week in the year. And if you're beginner runner, your rate of injury is actually much higher, I mean, twice as high as someone who runs a lot. So obviously the question is, how do you become experienced at running, running for more than 20 kilometers a week without getting injured? And I guess the answer is in this chart, is that you want to run, and sort of want to avoid being in this area and want to be in this area. So you have to run an intensity below this line and a frequency below this line, which unfortunately differs for everybody. So you have to find that out for yourself. So this is a kind of complicated chart, but really says that somewhere in between your load and your training frequency, there's a perfect area for you, depending on who you are. And if you overtrain, or sometimes even undertrain, then your risk of injury increases, okay? So how do we do this? It's really by getting someone else to supervise you if you're a complete beginner, and gradually increase your load and frequency of training, and then vary your training to sort of challenge your body and avoid boredom, I suppose. So I think this is one of the last complicated charts that I'm going to put up. But I think when people come to me and say, I train every day, several hours a day, and I'm getting injured, I try and suggest that when you train, you get fatigued, and then you recover, and then actually for a brief period of time, your body is actually stronger. And that can be sort of 48 to 72 hours after you trained. And that's the ideal time to retrain and hit your body with another sort of training cycle. So you get stronger and stronger and stronger without injuring yourself. So anyway, that's perhaps there's something to think about. So anyway, I'm going to talk about some of the common injuries that I see during running. And there are quite a lot, unfortunately. So I'll start from and they mainly affect the feet and the knees, because those are the areas that take the most impact. And one of the commonest situations I see is people who have pain at the bottom of their feet, just underneath their heel, and that's something that can be quite severe and stop them from running and walking around. And it's inflammation of this band called the plantar fascia, and that helps maintain the arch of the foot. It's very common in runners, and most people have experienced some of that. And usually it's a pretty benign condition that gets better with rest, medication, stretching, shockwave therapy, and sometimes even injections to the heel. Ankle sprains is also very common. People who who don't just run on a treadmill, go outdoors on a slightly varied terrain with uneven surfaces, they may miss a step, or they may roll their ankle, and this sometimes puts a lot of strain on the outside of the ankle, may tear this ligament on the outside called the ATFL, or by its proper name, it's the anterior talofibular ligament. But anyway, it can, if you damage it enough, you can get a lot of pain on the outside of the front of the ankle, and that can lead to chronic instability. And most of the time, you tend to get better with rest and an ankle brace and physiotherapy, and occasionally people have some reconstruction of their ligaments if the symptoms are bad enough. If you run too far and too fast, you may get some inflammation of the muscles on the inside of your shin, and that's called medial tibial stress syndrome, or sometimes, if it gets really bad, they call it shin splints. So people who join the army and run, long distances tend to get these sort of injuries. And really, it's a question of just dialing down your training, maybe thinking about the intensity of your training and the footwear that you have. Achilles tendon injury is also very common, there are all sorts of reasons why they occur, and again, they usually respond to rest and physiotherapy. Another common factor, I've had this before, is pain on the outside of your knee, which is due to the iliotibial band, which is a thick kind of band which runs from your hip joint down the side of your leg to your knee, and sort of friction of that band rubbing against the side of your thigh bone can cause a lot of pain. And it's thought to be associated with having weak hip muscles, leading to some interning of your knees. And again, that's, like most things, can be treated with rest, physiotherapy, this thing called shockwave, and strengthen your hip muscles. Pain at the front of the knee is extremely common as well. And I see plenty of people who say, look, I'm having started running, I get horrible pain in front of my knee, and it's due to a combination of biomechanical factors leading to pressure of the tissues against and the kneecap against the front of the thigh bone. And again, trying to correct those mechanical factors through physiotherapy and your running style is also important. So I think that's a whistle-stop tour of the running injuries I tend to see. And the main thing is, if it hurts, then don't just run through the pain. It's good to see an expert. It's good to actually identify your running goals and try and have a plan to get better over time. If you're a complete novice or you really want to improve on your running techniques, there are a lot of running coaches out there. Running in groups is good, motivates you, and also it's important to build up gradually and then have rest and recovery in the days between. Good to warm up and also cool down before your exercise and stretch afterwards. If you kind of have very flat feet, or if you think a lot of people have this thing where they roll their ankles as they run, called overpronation. There are a lot of foot specialists out there that can correct this for you. So then my next topic is cycling. So I've taken up cycling recently, in the last, seriously in the last few months, and I have a lot of patients who unfortunately do cycle and get injured from falling off the bike. So that's a lot of acute injuries like broken bones to the collarbone. But I also see a lot of overuse injuries, which have a similar spectrum of injuries to runners, but slightly different because of the different pressure and the biomechanics. So the first thing to say is if you do cycle is to always wear a helmet. And if you're in Singapore, it's not exactly the most cycle-friendly nation, so it's best to plan your route carefully and maybe go out at a very quiet time. See a fair few of these injuries: broken bones, broken wrists, dislocated shoulders, and those often require surgery because of the forces involved. So, I think that most of it is sort of common sense. Just try and be safe. If you're starting up, stick to the parkway connectors. Make sure that you're visible. Stay hydrated, make sure your bike's in a good condition, and obviously don't ignore any injuries. If you are taking up cycling, you're new to it, then sometimes increasing your physical conditioning is also beneficial. Now, this is a pet topic of mine. High intensity interval training is massively popular in Singapore and around the world. And there hasn't really been a lot of data and studies on it. And I see a lot of injuries from it. There was a study in the US on this National Injury Register for about 9 years, and that resulted in 4 million recorded injuries from high intensity interval training. But due to the popularity of the sport, perhaps, and also the variation between fitness routines and gyms, there's not been a lot of data to say how it happens and why it happens. This is Royal Huddleston Burpee. He was an exercise physiologist and inventor of my most hated exercise, the burpee. And he actually invented it as a fitness test. And he actually intended it only to be performed 4 times because he thought it was such a difficult exercise if you did it properly, and he didn't put in a jump. So I think it was only later on in his career that he included it as a fitness exercise for the army. It just goes to show that it's a very common exercise, was thought to be extremely demanding by the inventor, and overuse can lead to a lot of injuries. Sorry about this picture. A sport, CrossFit is, I think, an amazing sport and discipline. And and there it has some amazing athletes, but a sport that encourages a lot of powerlifting moves and trying to do them as fast as you can without proper attention to technique can obviously lead to injuries. And up to at least a third of CrossFit practitioners at any one time may be injured or have some sort of injury, which is pretty amazing, really. So unfortunately with HIIT, we don't have a lot of data about why it happens or how it happens, but anecdotally I see tons of people with injuries after HIIT, and I think it's important that especially if you're beginning to focus on your technique and your form, better to be supervised than just do things by yourself. And it's important to have some rest, because I do have patients who do 10 HIIT sessions a week, and then they come in and say, well, no, I don't know why I'm injured, doctor. So rest is very important. Stop if you feel pain, and I think HIIT is very useful to vary a training program, but by itself, I'm not so sure. Tennis is also a sport that I see a lot of injuries in, and I see a lot of combination of upper and lower limb injuries, commonly rotator cuff injuries. Those are the muscles that are attached to the top of your shoulder and help you rotate and move your shoulder. Tennis elbow injuries, pain around the forearm muscles that attach to your elbow, and also lower limb injuries. And funny enough, people who change racket sports, switch from tennis to squash, badminton, seem to be the ones that come to me a lot with injuries. I'm not sure why, but it's the subtle changes in technique and need and the racket swing. So the shoulder is actually a very complex and delicate joint. It's the most mobile joint in the body, and usually when things go wrong, 2 or 3 things go wrong at once. And the rotator cuff injuries are certainly some of the most common, as I've mentioned, and they occur through sometimes innocuous injuries. People notice that they've got this pain after playing tennis for a couple of hours, and it gets worse and worse over time, rather than having a sudden force. And pain at nighttime, worse on lifting your arm, can be a sign. It can be associated with lots of other things, such as impingement, where because of the loss of the stabilizing force of the rotator cuff, the top of the shoulder rubs against this bone at the top of the acromion, and that can lead to pain when you're lifting your arm like that. You get sudden pain at the front of the top of your shoulder. And most of the time, this can respond to rest and physiotherapy, but if it's severe and you have a lot of limitation of movement, then some people need surgery. Tennis elbow, as the name suggests, it's thought to be really from when you're trying to do a lot of topspin forehands, getting the ball over the net, and that sort of rolling action if you're a forearm. I'm not a very good tennis player, unfortunately, but I do see a lot of tennis elbow, and it's a repetitive strain of these muscles being inserted onto the bone here. You get sort of this pain just the front here, and it's very sore. Then that's most likely tennis elbow. And a variety of ways to treat it, usually involving rest and physiotherapy, shockwave, dry needling, and sometimes even injections of something called platelet-rich plasma can sometimes help. So my final topic, I think I've kind of whizzed through this, is Zoomitis, which is a general term for neck and lower back and posture-related complaints related to sitting in front of the computer screen for about 12 hours a day. I guess people who work in an office can also suffer from this. It's interesting that I have patients who work for major tech companies like Apple or Facebook. Don't mention anything. Someone's sort of made who basically have physiotherapists going around to check that they have the right posture and to correct their sort of ergonomic workspace. So ergonomics is really the definition of defining it as really the interaction of human beings with their working environment. So if you sit like this all day, hunched over like Quasimodo, then you can run into problems. But if you have a nice posture, your eyes are at level with the screen, and you're sort of, everything is sort of right angles to the floor. But if even better, you have a standing desk, then you may be at less risk of getting at these injuries. Suggestions to try and avoid these problems with your back and your neck is to try and get up every hour or so and stretch and make these sort of small adjustments that can make a difference. And also core training, Pilates, strength and conditioning can make a difference as well. So back problems are extremely common, and they're often from two things. They're from what's called a slip disc, which has a lot of names. People call it slip disc, herniated disc, prolapse disc, disc bulges, and they all have this, various descriptions, but really means the same thing. It's a bulging disc. The discs are sort of shock absorbers that sit between the bones in your spine, and sometimes they can bulge out for whatever reason and press on or irritate the nerves just behind them, which sometimes causes pain radiating to your buttock or down the back of your leg, and that can result in numbness or weakness, or if it's very severe, or even other more severe symptoms. But on the whole, most back problems tend to resolve with physiotherapy, core strengthening program, although that sometimes may take several months, and there are faster ways to do it, but obviously that's another topic in itself. So I think that it's been a pretty quick run through of the injuries, but I think from my previous talks, I tend to concentrate a lot on your questions and try and answer any individual queries. So I think that now is a good time that if you have any questions, just to type in the chat so I can go through them in just a second. So my general advice really to prevent injuries is, if you're taking up a new sport or activities, just like the one I've mentioned, it's just to take it in bite-sized chunks and don't try and kind of plan for a marathon from day one. So it's good to have an organized plan when you start out activities, because actually then you get to where you want to go a lot faster, rather than meandering along, then getting injured and then giving up the sport. Technique, if you're doing a particular sport, is very important. Resting and recovering between exercise sessions is also pretty vital. If you're finding it a little bit sort of too much, it's good to try a different sport, and like swimming or cycling, if you do a lot of running, for example. If you are cycling particularly, it's best to try and protect yourself as much as you can, wear the right equipment, and warm up and cool down between activities, stretch afterwards. Trying to ignore pain. Muscle ache after a vigorous exercise session is normal, but if it doesn't go away after a couple of days, then it might be worth seeing someone about it. Staying hydrated in Singapore and using sunscreen is also quite important. It's pretty hot and humid climate out here. And don't forget to have fun. So I guess this is the shameless plug, I'm sorry, but here are my details. And again, thanks very much to Susan and Vicky for your help in Expat Living for hosting the talk. So I think I'm just going to flick to the questions here, and then someone I think so. The first question I got is that. So let me just stop sharing the screen so you can see my face. So,
Dr. Allen, I can read them out for you. So that
okay, yeah, okay, thanks very much. That's kind of you.
That will make it. I'm sorry, my neighbor is doing some renovation, so I hope you cannot hear the drilling. I do apologize for that if you can.
No, it's okay.
Anyway,
it's okay.
I think you touched on a little bit about this. Someone was asking about like recommendations regarding days of taking the day off. So let's say, like for me, for example, if I would start running, when would, so this is like I'm not the most, I'm not the best runner. I run very slow, but I do like to run. So what would your recommendations for me in terms of taking the day off? Do I run every 2 days and take a day off, or do I run 3 days and take a day off, or do I take the day off every other day?
So I think that a lot of this depends on how experienced you are as a runner, and then how far you want to run and what you're aiming for. So, by all means, when I'm, say, running for a race, what I will do, for example, is that because I'm not a physical trainer myself, I'll go to a website like Runner's World, and they'll have a 6 to 8 week program for running 10K. So that's a good start, because that's usually written by very experienced runners, and they will sort of build you up your distance and your running routine and what to expect over that period of time. And typically they will have, if you're starting, I recommend taking at least a day off between your running sessions, and it's the same thing for people who do a variety of sports, trying not to exercise the same body part for more than 2 days in a row, because you're just not really giving it enough time to recover. So that's a difficult question, because everybody has a different goal and has a different sort of aim of what they want to do. And if you're finding that you're just after, if you're doing a few sort of runs and you're starting to pick up some niggles and pain, and it's just not fun or comfortable anymore, then you're probably doing something, you're trying to cover too much distance, or trying to overwork your body in certain ways. So I would definitely if you're starting out, I would definitely take a day off between your sessions, and if you have to exercise, maybe try and cross train and do something different like swimming or cycling, or go to the gym, and just to get a bit of variety. So I hope that answers your question.
Yes, definitely. Thank you.
Okay.
I'll remember to do that.
Yeah.
EJ is asking
Yes.
about, EJ is asking, hi, Dr. Cheung. I've been running every single day since the 1st of December. I alternate between 10K steps to 20km daily on a monthly basis, giving myself rest whenever required. I'd like to know more about video gait analysis for flat feet. What is that?
Okay, well, firstly, thanks very much for the question, EJ. I think, firstly, congratulations. You're obviously quite an experienced runner, and now you've basically, got to, I can't quite measure whether you're sort of walking and running, but I think that you're probably running fairly continuously, and you're running on a daily basis without apparently getting injured, which is a great achievement, really. So the first thing is that, whether you have flat feet or not, is that you're doing something right in terms of something for your own particular body style and intensity of running. So that's great. So congratulations. So flat feet is when you normally look at, your feet in the mirror, or you look at your kid's feet or your partner's feet, you notice that there's a bit of an arch like this. And that helps transfer the force when you strike with your heel of your foot, and and the force of your foot, and then pushing off with your big toe, the arch of the foot helps sort of keep that kind of midfoot stable and transfer your force efficiently to your toe as you push off. So some people from childhood or adolescence have quite flat feet instead of having an arch. And for the most part, that's not a really huge problem, although some people do get a little bit sort of, do feel that they need to wear insoles to try and maintain the arch. The only problem is for the rare occurrences when the foot is totally rigid, and rather than being sort of slightly flexible when you sort of push the toes up. And there are rare medical conditions which cause that, and which can cause problems in later life. There are podiatrists out there, and I don't really feel like I should mention certain names, but I can, that I certainly work with, that do a video of you on a treadmill to see if your foot, when you strike, rolls from side to side, what's called overpronation or oversupination, and they can prescribe some orthotics or recommend certain types of shoe to help you with your running. But to be honest, I mean, if you're running 20 kilometers daily and you're not having any particular problems, but you just happen to have flat feet, then sometimes if it's not broken, then you don't necessarily need to fix it. And sometimes if you do go out and try and adjust something, ironically, it can lead to sort of injuries and changing your running style. So by all means, if you have pain in your feet, then it's worth doing something about it. But if you're managing to do so well and, you know, and without a break, then obviously then you're doing something that works for you. So that's great. Well done.
That is quite impressive. 10 to 20 kilometers. That's pretty good.
That's incredible.
And in the Singapore heat. That is very impressive. Another question with CrossFit, for example, let's go on to that one. How does one decide how much kilos to lift? And would light weights do any difference at all if you decide to do light weights?
Well, I think that firstly, the only way I can answer this question is from a personal point of view, because I personally stay away from CrossFit because I got a lot of shoulder injuries playing rugby when I was younger. And so my shoulder flexibility is very poor. So I can only kind of lift my arm to up here. Whereas if you're doing powerlifting exercises and you really want to get the full range of shoulder, you really need a very good range of motion with your shoulders to be able to get those weights right above your head without arching your back. So I picked up a lot of back injuries in my time doing things like overhead exercises and even doing deadlifts and squats, because I'm just one of those people who foolishly went to the gym and thought, I can do this, looks easy, did it, lifted too many weights over a period of time and injured myself. And for me, you know, I weigh about sort of 70 plus kilos, and every time I got to about 35, 40 kilos, I would injure myself. So I'm not saying that's the same for you, but I learned my limits the hard way. So the best thing that I could have done was age 16, go and see a sports trainer who would actually teach me the techniques properly and do a 2-month training session for me, showing me how to do things properly and, you know, tell me what my limits were. And everybody tries to push to the limit when they lift weights, and everybody ends up with some sort of injury. That's just the nature of going to the gym. Now with CrossFit, I think that it does tend to produce very amazing, very dedicated athletes, but at some point, you know, at any one point in time, a third of those athletes will be injured. So I think the answer is that it really depends on your experience at lifting, and your technique is important. Sure, lightweight starting off would be very important until you get a good technique. But at some point, you are going to run into problems if your technique doesn't become good. And that can become, your technique can fail because you're lifting weights repetitively and you tend to fatigue. And the first thing to go is your fall. So I think it's a very personal question, and you just have to be quite careful.
Yeah, I mean, there's so many apps now that shows you, oh, you know, you just have to lift 5 kilos, and they don't really exactly show you, because they're in that app. Sorry, the drill is going crazy over at my end. That you do tend to end up with an injury that way, isn't it? I think it's much better to have someone to show you. Definitely.
Definitely.
Okay. Recovery. What is the best way? Do you drink sports drink? Do you drink coffee afterwards? Because that's what we do. We drink coffee after we have our little session in the park, but that's not good, right?
Okay. Well, I think looking at the question, there's sort of two elements to this. So, recovery. What's the best way? I mean, I think that whatever you like to do, water is going to be number one. You know, our bodies are majority of our bodies composed of water. And you can, if you really go out there and spend 2 hours in the sun training away, there's plenty of electrolyte drinks out there. I'm not going to mention any, which can help you sort of, or supposed to help you recover faster. But I think the main thing is just to drink lots and lots of water. How can you tell you're drunk enough? Well, usually on a daily basis, people are supposed to drink 3 liters of water a day. But if you're going to the toilet and your urine is clear and sort of not dark and smelly, then you've drunk enough water to recover. And all, so I don't recommend a particular sports drink. There are lots of electrolyte mixes out there, but for people who are not sort of professional athletes, I don't think we really need to go into the pros and cons and of which particular drink is better than the others. So just drink lots and lots of water. If you like to have something a little bit sweeter, then fine, have a sports drink. There was another question actually in the middle of that about what would you do if you're a little overweight to prep yourself for running? So I think that it's always a catch-22 is that, how do you're trying to lose weight, but you don't want to injure yourself, is that you can always, you look at 2 things. You look at your diet, which is, a huge topic. And, personally, when you live in a gastronomic paradise like Singapore, it's very hard to lose weight because food is so plentiful, it's cheap and it's delicious. But, if you really are serious about it, then you have time to maybe get professional help, see a nutritionist or a dietitian who can help you count calories, come up with a sensible plan. Because the problem with diets is we always crash and burn, and it's more about changing your lifestyle, really. And then if you're worried about injuring yourself, overweight, if you're a little overweight, is to maybe think about another sport that can place less strain on your body, like swimming or cycling. And if you're going to run, then run short distances at a time so you don't overload your joints and build up from there. So I hope that answers your question. I think
Definitely.
Yeah.
I think that's very important too, because I know somebody who was severely overweight and he was very stressed. And unfortunately, at one point, he also lost his job. And so he was like, right, I'm going to be, the new me. I'm going to start, my new life. He went to the gym and unfortunately he had a heart attack.
Oh dear.
And then there was no more new life, which is very sad. So,
Well,
it's very important, isn't it, to just take it easy?
Yeah, I also, something I probably should have mentioned is that if you haven't done a lot of exercise before, is also and you have a pre-existing medical condition, is to go and see a relevant specialist to make sure you're actually fit to exercise. So there are all sorts of, I think a lot of people who work in the corporate environment have these health screens, but they do have their uses. At least you're doing something. If you have a history of heart problems or blood pressure issues, then it's good to see a cardiologist to do some tests or screening. I know it can be expensive in Singapore, but you just have to be a little bit careful. And very sorry to hear about your friend. Hope he's better now.
Well, unfortunately, he passed away after that heart attack. So.
Oh, okay. Sorry to hear, Susan. Okay,
well, actually, he wasn't my friend. He was a friend of a friend.
Friend of a friend. Okay.
In Singapore, everyone knows each other, so everyone is my friend. So Lynn is asking a question. She says, you mentioned earlier the pain on the outside of the knee. I have pain in the inside of the knee, in her right knee, and it sometimes just happens like a tick whenever or not that I am exercising. Why and what causes this to happen?
Okay, well, I guess, Lynn, thank you very much for the question. And it's diagnosing injuries on the internet and by telemedicine is a big can of worms, but I can show you some structures on the inside of the knee. Just hold on, let's get my knee model. Okay, so this is my model of the knee that I show people. Okay, so this is like a stripped down model of the thigh bone and the shin bone, and this is the inside of the knee. So if you look at the inside of the knee, then there can be lots of structures which get damaged. Sometimes people sprain this ligament here, which is a stabilizer of the knee and stops the knee from wobbling too much when you do that. And that's called the medial collateral ligament. Sometimes you can injure this structure in the inside of the knee called the meniscus, which is like a shock absorber. Sometimes you can damage the cartilage, which lines the joint. And on top of that, you can get referred pain from the kneecap, which isn't here, but sits there. And sometimes you get discomfort along here. And there's also lots of muscle. So in short, the answer, Lynn, is I'm afraid I don't know what's wrong, particularly with you, but there are lots of structures there that can cause pain and might be related to your prior injuries that you mentioned, which I'm not privy to. But obviously, if it's really bothering you, then please go and see someone.
Yes, Lynn, go and see Dr. Allen. Give him a call later. Okay, one more. This is regarding, again, pain in the knee, arthritis. I know running is not recommended, but how about brisk walking? Is that something we could do if we have arthritis?
Cheung, I hope I pronounced that correctly. Thank you very much for your question. And yes, I think that light to moderate exercise is thought to be, for the early stages of arthritis and wear and tear, can be helpful. But you're right that low impact exercise is thought to be more beneficial in terms of swimming or cycling, and definitely walking is better than running. Luckily in Singapore, we don't have a lot of steep gradients. If you have a problem with your kneecap, then people find that walking down lots of stairs, up and down lots of stairs, can be quite painful if you have arthritis. But I think that doing a physiotherapy program to strengthen the muscles in your leg and walking is a perfectly reasonable option if you have early arthritis.
No, go on.
Yeah, so I mean, I do see a lot of patients with arthritis, and they can be many different stages, but you can still, at least in the early stages, you can still lead a very active, productive and happy life, even though your joints are starting to wear out a bit. If your joints are really worn out, then luckily we live in an age in the 21st century where, and we have access to joint replacements where you can restore your quality of your life as well. So I think that it's a problem that you don't have to kind of suffer with. And like most problems, it's good to see someone if you do have arthritis in the knee. So thanks for that question.
Okay, I'm just going to jump through some of the other questions because we have a few. So, and I know you have to see patients today. So
that's okay. Yeah, I'm happy to answer.
One question is, this is from Stacy. I brisk walk 12 kilometers every day. That's very impressive. Do I need a break from brisk walking? 12 kilometers a day is okay, isn't it? Sorry, yeah, I'm now the doctor, Stacy.
Well, Stacy, I think that you're obviously quite a fit, strong individual, and it really varies from individual to individual. Say, if you think about it, if you think about when you first started exercising, whether that was, a year ago or many years ago that you started walking, you probably couldn't manage 12 kilometers in one go. And that's the crux, is that you've reached a steady state where your body is used to doing that 12 kilometers. Whereas if you said to yourself, I want to enter a walking race, and I'm now going to walk 20 kilometers instead of 12, and that's where you might start to run into problems. And then you might need a break and have a bit of rest and recovery, do some strength training or something like that. So for you, for your level of fitness and what you're accustomed to, I don't think it's a problem. And just keep going until you start to feel some pain or you manage to injure yourself in some way, touch wood. So yeah, I think that if it's okay for you and you're happy not to take a break, then by all means don't.
Okay.
Yeah.
One question from Jessica. She says, I have pain whenever I do any sort of squats, cycling, or even climbing stairs. Deadlifts are much more safer for my knees. Is there a way I can still squat without annoying my knee? It's more my left knee, she says. My back is quite arched, which makes my hips quite pushed forward.
Okay. Well, I think that, again, Jessica, thank you very much for the question. It's a difficult question to answer without knowing sort of, is it like a body weight squat, is it a weighted squat? How long have you been doing these exercises? And sort of what is your exact technique? I think if your pain is mild and you feel that it's not debilitating, then it's okay to go and see a trainer with a qualified trainer to go through your technique and see if that will help. If your pain is moderate to severe and it's really affecting your daily activities and your sleep, for example, then you may have an internal problem with your knee, which is causing the problem, like some worn out cartilage, torn meniscus. And so whatever you do with your technique, it's still going to cause you pain. And that's when you should get it checked out by an expert and maybe get some imaging or a scan of your knee.
That's good advice.
Yeah.
Another question here. This is quite interesting. Have you found women who are perimenopause or menopausing, are they higher risk of injuries?
Well, thanks very much for the question, Jane. I think it's an excellent question because it doesn't mean that they're higher at risk of injuries, but it brings up the topic of bone density, which I think is a very important topic. So bone is a living thing and is regulated by hormones, including estrogen. So it's a kind of simple statement to make, but when you go through menopause or for whatever reason, it affects your sort of hormonal cycle, the bone can become weaker and less dense. And as we grow older also, our bone becomes less dense. So there's some people whose bone becomes weaker, and we call it osteopenia, or thinning of the bone. And at some point, they reach a point where it's called osteoporosis, where when they fall over, they're at increased risk of breaking the bone, particularly their wrist or their hips or their spine. So there are many risk factors for osteoporosis, and that includes early menopause. So that's, for example, menopause before the age of 45, endocrine problems to do with your thyroid and the glands that regulate your calcium metabolism, gut problems which affect your absorption of calcium, if you have any dietary problems, and many other factors. So if you have any, and also a family history of osteoporosis, or if you've ever broken a bone before. So if you have any of those risk factors, then it might be worth speaking to your GP or friendly doctor to get screened for osteoporosis. It's just a simple X-ray called a DEXA scan. And that can just give you some reassurance that you don't have osteoporosis or a high risk of breaking a bone if you fall over.
Okay. Okay, another question from Si Ying. And I don't know if you can answer this, because this is it's more about picking an ergonomic chair. So she asked, as in, what do we need to take note of when choosing ergonomic chairs, since there's a wide range in the market? I mean, I assume that Si Ying has some, issues and injuries before. So do you think she should see a doctor and get some X-ray to then go and say, right, this is the kind of chair I need?
Well,
if I could just add on, I typed a comment. I have this recurring intermittent tail end spine discomfort, possibly due to prolonged hours of sitting. I feel better when I'm in office, given I suspect it's the ergonomics. So that's why I'm asking if there's out of the many types of ergonomic chairs out there, is there anything that we will need to take note of?
Thanks very much, Seeing, for the question. And I guess I can only, without examining you and asking a lot of questions about your condition, I can only make a broad statement that I wouldn't go out and I would definitely not think that a chair is the magical solution for your problems. And there's a combination of factors as to why it's happened in the first place. Please don't think that you should go out and spend thousands of dollars on a magic chair that will solve everything. Usually, problems with your spine or your tailbone are sort of build up over years, like a problem with your disc, or and pressure from sitting for hours on end. and maybe a problem with your core strength as well and your posture. So, you know, at the very least, you can go and see a physiotherapist for an assessment to look at your posture and your spine and see where it may be strengthened. And some physiotherapists even offer an ergonomic assessment of your workplace to see whether, you know, your chair is at the right height, whether your eyes are at the level of the screen, whether your elbows are the right angle, and this sort of thing. So buying one chair, it's not a one-size-fits-all problem. Your problems are more complex than that. And therefore, it's worth, if you are really worried about it and you have a particular pain, it's worth seeing someone to get it checked out, rather than thinking that a chair is going to solve all your problems, I'm afraid.
Okay, and there's one for Karen. I think maybe Karen, you have to go and see Dr. Allen for this one. She says, I got hip impingement pain for 9 months. I rest and straighten my hip muscles with regular morning exercises, but it's still there. And I think that I unconsciously repeat wrong moves or posture each day, and I don't understand why it takes so long. Any advice?
Hi, Karen. Hi, Karen. Thanks very much for the question. I'm sorry to hear about your hip pain. There are a variety of problems that can cause pain around the groin area. One of the commonest ones is when you have one bit of bone rubbing against the socket, and there's an extra growth of bone, so that you get a pincer effect, or what's called a cam lesion, causing the pain. Sometimes often there's a bit of the lining of the hip at that point where the hip rubs against the other area, and that may cause a tear of the lining of the hip. Other common causes are some damage to the cartilage, some strain of the muscles around the joint, and referred pain from other structures in the groin, even the spine. So I think that, you know, in generalities, if I'd had hip pain for 9 months and it wasn't going away, I'd seek some professional advice, because I can't really fix it over this brief 10-second conversation that we've just had.
Yeah, it sounds very, very painful, Karen. I feel very, very
9 months.
sorry that you're experiencing that. Yeah. Oh gosh. Yes. So if there's anything we can do let us know, and connecting with people, definitely. Another question. Hi, my 7-year-old son has flat feet. He seems to be doing okay, but people tell me I need to get him treated to have the traditional arch. What would be your recommendation? Should we get him treated, or?
Well, Pals Aurora, thank you very much for the question. Well, I think that in modern society, when people see that this is a very kind of complex question, I think the simple answer is, if he's happy, he doesn't have any pain, and he seems normal, then he probably is normal. If he's able to play sports without any difficulty, and you know, if you had a look at all the Premiership footballers, probably about 10% of them have flat feet. Does it make them worse at football? Obviously not. But there are some people who do have, you know, a way of walking, or, you know, that may cause pain or discomfort. So it really depends on the symptoms. And, you know, if just because you're comparing him to people with kind of with arches in their feet compared to a flat foot, it may be genetic and not really his fault. You know, if you or your husband have flat feet, it may run in the family, but might not necessarily be, you know, an illness or a pathology. It just is. So it's very common for children to have orthotics in their feet, and some say it really helps them in their sport or running, but it really depends. If your son is already an elite athlete and playing sport at a high level and has never complained about their feet before, then I suspect that orthotics or insoles may not make a huge difference. I hope that answers your question. But if he has a lot of pain, he's finding it difficult to play sport, and says, you know, he gets tired easily and can't do very well at certain things, then it might be worth getting assessed.
I just want to add up. Is it going to lead to any back problems later on as he grows up?
I think that that's a very difficult question. I don't think anyone can answer that. The problem with back problems is that everybody, once they reach a certain age, gets back problems. And that's a given because we sit in an office chair for hours on end, we go out and lift up heavy weights, we pick up children. And so, but I don't think having flat feet and necessarily having is always going to lead to having, I don't think correcting flat feet will cure any back problems necessarily in later life.
Oh, thank you.
Yeah, okay.
Thank you so much.
Okay,
this one
thanks.
is from Jessica. So she has a question. So Jessica says, is there any way to correct an arched back to have less of an arch due to lumbar lordosis?
Okay, well, thank you very much, Jessica, for that question. So for those out there who are not aware, in our spine, we have some normal curves. So when you look at someone's back, it's not always totally rigid and straight. It's not meant to be like that. And so it's actually quite normal to have a sort of a curve to your spine. So I'm just going to pull up a picture which I can share with you briefly, which I tend to do because it's better to look at a picture than to. So I just asked Dr. Google. So on the top right of the screen, you can see in your neck, you've got a slight curve, and that's called a lordosis. And then your chest, it goes the other way, and that's called a kyphosis. And then in your lumbar spine, it curves again inwards, and that's a lordosis again. So you're actually meant to have some nice curves in your spine. The question is, so I'm just going to stop sharing the screen. The question isn't the curves, it's more that do you have any pain in your back and do you have any symptoms? Because, you know, when we lie down, you know, our lordosis corrects for sort of gravity and so on and so forth. But I suppose there are so many underlying conditions in the spine that can cause pain and disability rather than having a slight curve. So I think, you know, if you had pain in your back, it's best to see someone if you have any concerns. It's a difficult question to answer from this context.
Yeah, definitely see someone is my suggestion as well, because it sounds quite that she has quite a curvy spine.
I
don't even know what that is called.
I don't give people a complex. And again, you know, I have all sorts of patients, particularly, and many patients bring their children saying, oh, my daughter's spine is slightly curved. What should I do about it? And actually, and that's a curve the other way called scoliosis. And actually, scoliosis occurs in about 10–15% of people. And most people don't need any active treatment. So we don't need to be too, it just depends. Everyone has a very rigid idea that everyone must be totally straight and, you know, just like everybody else. But human body doesn't happen like that, unfortunately.
Jessica says she's Middle Eastern, but it doesn't have anything to do with what race you are, is it?
No, I mean, I don't think so, no. I mean, everybody has some slight curves to their spine. And I think there are probably some, you know, if you go out to some parts of the world, maybe some genetic differences, but, you know, I don't think Middle Eastern people are particularly known for curvy spines.
Okay,
yeah.
Right. So you touched base on this before. EJ is asking, would you say you see a high number of injuries where any at all resultant as a lack of warm-up? So sometimes this happens to me as well. So sometimes like my CrossFit trainer, you know, she's very busy and she's like, yeah, come on, let's go. Everybody's chit-chatting and she kind of just jumps on the warm-up so we don't get that much. And do you think you see a lot of injuries because of this, like not warming up before the actual workout itself? Or do you say it doesn't really matter? Well, we know from studies that for certain sports like football, doing a warm-up of certain specific exercises for, they do 20 minutes before they start playing can actually reduce the risk of a lot of injuries.
to say the ACL and the hamstrings. And so I do recommend that particularly people starting out do light exercise to just get used to the technique and the form. And certainly I have people who go out and play basketball or do these sort of what's called a plyometric exercise, where they suddenly go from standing to suddenly explosive force. So like a jumping exercise or sprinting, or and they're the ones who tend to pull a muscle or tear a hamstring or tear their Achilles. So I do anecdotally get a lot of those athletes. I think for less explosive exercises, ones that sort of maybe more repetitive, because we're in an environment in Singapore where it's quite warm and humid, our muscles aren't tense, and if you're reasonably experienced at exercise and you do it regularly, you may get away with not warming up as much as other people. But most organized classes I've been through have warm-up sessions, usually for a good reason, to try and reduce the rate of injury. I don't think it's not a foolproof way to do it, but it can certainly get you into sort of the zone of exercising.
And stretching afterwards is also very important.
Stretching afterwards is supposed to be better than stretching before. It's been shown that if you stretch a lot before you exercise, it can actually hinder your athletic ability. So stretching afterwards is okay, but you don't have to stretch before.
Okay. Yeah, my husband never stretches, and he walks like a very old man after playing tennis. And I always tell him you need to stretch. But he's Australian, so he always says, "Oh, I'll be all right." So anyway, thank you so much. That was so interesting and so enlightening. I mean, I never really know anything about injuries before after today. We should have this every Friday, like a consultation with Dr. Allen.
Yeah, we should do. Yeah, we should make it a regular session. It'd be fun. Yeah, absolutely.
Absolutely. I think we should have that as part of our expat living talks. It's so much fun, and you're so relaxed and easy to talk to, and I'm sure everyone would love to come and see you. And how, if they want to come and see you, how are they going to get a hold of you? Can I share your details with them?
Yes, please. That would be very good. I'll repeat my shameless plug again. Sorry. I think it was right at the end. So, I mean, I guess you can always Google me, but I'm based at Mount Elizabeth Novena Hospital, and there's many ways to get in contact by email, telephone, or even WhatsApp, but it's probably more efficient to do it by email or telephone. But again, thanks very much again, Expat Living and Susan for organising the talk, and Vicky from Oslo Health for all your support. And thanks everyone for tuning in. It's been a real pleasure. It's been a lot of fun sharing your sort of insights into your exercise habits. And I'm very impressed actually with everybody who's sort of walking and running such long distances. They managed to get to that level. I'm terrible at running myself, so well done. Yeah.
It is very impressive that everybody's so fit, actually. And that's just what expat expat living readers are. We're all very fit. Actually, I promised everyone a giveaway at the end of this talk, actually, and so I arranged a giveaway of a beautiful bottle of perfume from Bulgari, and I've randomly chosen through the chat. Lynn Lim has actually won the Bulgari. Yay!
Wow! Congratulations!
I can see you. I can see you on your camera there, going ah. Congratulations. I will send that to you. I think I have your address and all your details, so I will touch base with you later. And also, because it's Friday, we're giving away some wine. Sorry, Dr. Allen, I know this is a sports talk, but there has to be some moderation and some balance in life, right? So we're giving away some wine, and Jessica Stevens, congratulations, you won the wine that you can enjoy this weekend. So I will send that over to you. And with that, thank you so much for joining us this morning. It's always so nice to see everybody on the Fridays that we have talks. Dr. Ellen, I hope you'll join us again next time.
Yes, I'm looking
Have
forward
more
to it.
consultations.
Uh,
You know, next time I think you should have like a little model to show us, like, you know, ergonomic things and how, you know, the limbs work and things like that. I think that
Yeah.
would be a great idea.
I'll bring
I
out a
will
live
not-
model.
Yes, it's not going to be me though, but I mean, I guess I could volunteer, but we can arrange that next time.
Okay.
Thank you so much. Have a great day
It's been
and
an
a
absolute
wonderful
pleasure.
weekend to everybody.
Okay,
Thank
thanks a
you.
lot. Bye now.
Thank you. Bye.
Bye.